Canada is expected to receive up to 168,000 doses of the Moderna vaccine by the end of this month. That's, of course, contingent on approval from Health Canada, but the vaccination campaign in Ontario is well underway. Injections of the Pfizer-BioNTech vaccine started in Toronto yesterday and Ottawa today. Here's Premier Doug Ford speaking about that earlier.
The Ottawa Hospital has started their first vaccinations today, and they expect to vaccinate approximately 100 people. As of noon, we've vaccinated approximately 142 frontline healthcare workers, over 80 at the University Health Network, and over 50 in Ottawa Hospital. And the University Health Network expects to vaccinate approximately 325 people today, another 325 people tomorrow.
The feds say Canada will also receive about 200,000 doses of the Pfizer vaccine next week. The number of vaccination sites for that specific vaccine will be expanded from 14 to 70. For more on all of this, we've reached retired General Rick Hillier. He's the chair of Ontario's COVID-19 Vaccine Distribution Task Force, and he's in Toronto. Hi, General Hillier. Good to see you again. Thank you for making the time.
My pleasure, Vashi.
I wanted to start off on the federal government's announcement today of the possibility, contingent, of course, on Health Canada's approval of 168,000 doses of the Moderna vaccine by the end of the year. Do you have any sense of those vaccines, how many, or doses rather, how many Ontario would receive?
Vashi, we really do not. I mean, we've heard some numbers out there of the Moderna vaccine, potentially 35 to 40,000 for Ontario. But these are just things that we've heard. We have no precise figures at this point in time. We're not sure when it will be actually approved by Health Canada, presupposing that approval does come. But as we said before, we understand that. We know we're operating in a void, all of us, and our commitment is simply to be ready when it is approved and we do get the first vaccines, and we hope that's very soon.
Should that happen, should, for example, the scenario you painted off the bat as a possibility, and just a possibility, but 35 to 40,000 vaccines before the end of the year, where Moderna is concerned, be delivered to Ontario, are you prepared at this point to distribute those and actually use them as vaccinations?
Oh, we are, Vashi, we are. We've got hospitals that are geared up to do this with teams ready to go. Our first priority would be to, obviously, with the Pfizer vaccine, continue the vaccination in the sites where we started and had many more to it, so we can get the healthcare workers and we can continue with the workers that work in some of the long-term care homes or retirement homes. But with Moderna, that gives us a mobility that we've been lacking with the Pfizer vaccine. And what we want to start doing is getting out to those, and I've said it many times, I know, but I'll say it there again, those long-term care homes and retirement homes that have been the scenes of tragedy and imposed on them by COVID-19, those homes in the hot zones, lockdown zones, most vulnerable with communal living or communal dining and more than one person in a room. And we want to make each of those in the best order that we can determine, a special vaccination site, and give the residents that are there the opportunity to be vaccinated, in addition to the personal care workers, the staff, and the healthcare workers, and the essential visitors that are necessary to look after those residents.
Because the Moderna vaccine has far less complicated storage conditions attached to it than Pfizer, is it, based on what you just said, is it your intent, is it the government of Ontario's intent to use that vaccine primarily, initially at least, for people who actually live in long-term care homes?
Vashi, yes. What we have said from the start is that, and this is the direction of the government to the task force and to all of us that are working on this great mission, is that we are, number one priority is those in most vulnerable circumstances, and those I just described, along with the healthcare workers and the personal service workers and the staff that look after them, are those. And, you know, all you had to do, I think, was listen to the stories of the first 5 that were vaccinated here in Toronto yesterday, and the people who actually put those needles in and administered the vaccine, and realized just what incredible, frightening circumstances they have been working in over this past 10 months, how they have, stepped above and beyond the call of duty. And now this is the sort of lighting the light at the end of the tunnel for them and giving them that protection. And we know just by getting the workers in those homes and giving them the vaccination, we're going to increase the care and safety of the residents by, plus of 90%, because those people are the vector on which COVID-19 gets into the homes, and that will help. But we want to get to the residents, and the Moderna vaccine will give us the flexibility to start doing that as soon as it arrives.
What about more vulnerable people, rather, in northern remote communities in Ontario? Moderna federally will probably be used, for example, head first to the territories which couldn't access the Pfizer vaccine, at least at this juncture. Is that something under consideration specific to Ontario?
Well, it's under far more than consideration, Vashi. Absolutely. We want to get to those places that are more vulnerable. We started actually a planning group today, which is working to lay out the concept of operations and then an outline plan on how we would do it, what resources we would need, and how we would start. And just to give you an example, we want to identify really quickly how we're going to do it, and then who is going to do it, because before any of those people go into those communities in the north who have survived COVID-19 by remaining isolated, we want to ensure that they are vaccinated. And so really you're talking about a month from you making that determination of who is going to do the program, get them the first needle, get them the second needle 21 days later, and give them that 7 or 8 day period that takes, I believe it takes to become fully effective. And then only then would we want to have them going into those isolated communities. Obviously, we don't want to be the cause of a tragedy occurring by carrying the COVID-19 virus with us. So it's more than just thoughts. We're working to plan it out. And as soon as we get sufficient vaccines on the ground in phase 1 here in the first quarter of 2021, we are going to start the vaccination program for the North.
And so that won't begin until 2021, the beginning of 2021.
It certainly won't occur in December of last year. Again, we said those in most vulnerable conditions, and that's in those red zones and lockdown zones, like right here in Toronto, in those long-term care homes. And we're not getting many vaccines coming in, and we are being cautious because we are uncertain of the supply and when the shipments are coming. That we are administering half of the vaccines we get, and we're keeping the other half to ensure that we have the second vaccination shot available 21 days from now. Maybe that will change as we get a little more confidence in the actual supply of both Pfizer and Moderna and potentially other vaccines down the road here. But right now, since we don't have any of those details, we're going to err on the side of caution, make sure we have the second shot available. So there's not that many shots here in December and even early January. It'll be a little bit later before we get going.
Just quickly before I let you go, General, on that point, are you worried about security of the supply chain? Are you just insofar as you're holding half the doses back? Because you could be inoculating twice as many people as you are. But what is the genesis of the worry that you have over the supply chain?
Well, it's not a specific worry. It's just that we, up till now and going forward, we have not seen any specific dates or the amount of vaccines that will arrive or when they would arrive. And so, I kind of quote President Ronald Reagan, say, trust but verify. Well, we're going to verify by having the second dose. Once we have confidence built in the supply chain, and I don't think it will take long, then maybe we'll want to take the second approach. The federal guidelines have also been generally, hey, make sure you got that second shot ready to go. So until we have complete confidence, we don't want to waste anything by then on day 21 to 25 or so, not having the second shot available. So I think it's prudent caution, and that's what we're doing.
Okay, thank you very much, General Hillier. Appreciate your time as always.
My pleasure, Vashi.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.